The 8 extraordinary meridians. These are different from the 12 primary in 2 ways. 1, they have nothing to do with the zang or fu organs. They don't have an interior-exterior relationship connecting to them. Of the 8, the Ren and Du are the only vessels that have their own acupuncture points. So they're added to the primary channels, sometimes called the 14 channels. But when it comes to the 8 extraordinary vessels, there are 2 main functions. 1 is that they connect other channels together. The second is that they act as a reservoir for leftover qi, for excess, and for deficiency. And they connect through yuan qi in this way. The 15 collaterals include the 12 collaterals, and then the 2 collaterals of the Ren and Du, and then the large collateral of the spleen. So this is why they're called the 15. The 12 divergent channels diverge off the main channel to penetrate deeply into the body. The sinew channels distribute the qi and blood of the 12 channels to the muscles, joints, and sinews. The divergent channel of the foot Taiyin and the divergent channel of the foot Taiyin, so the bladder and kidney, separate from the popliteal fossa. They enter into the kidney and bladder, and they resurface at the nape of the neck. They join together with the bladder channel of the foot Taiyin. And this is why sometimes with kidney deficiency there will be nape pain. The divergent channel of the foot Shaoyang and of the foot Taiyin. So we're looking at the gallbladder and liver. They separate at the lower limbs. They enter the liver and gallbladder. They resurface in the mandible region. And then they join with the gallbladder channel of the foot Shaoyang. The divergent channels of the foot Yangming and Taiyin, so the spleen and stomach divergent channels, separate at the hip region, enter the spleen and stomach, resurface at the mouth. And then they join, again, the Yang channel, the stomach channel, foot Yangming. The divergent channels of the Taiyang and Shaoyin of the hand. So hand Taiyang, we have the small intestine, and the hand Shaoyin, we have the heart. They separate from the axillary region. They enter the heart and small intestine, resurface at the face, and join, again, the yang of these, the fu organ, the small intestine of the hand Taiyang. The divergent channel of the hand Shaoyang and the divergent channel of the hand Taiyin, so sanjiao and pericardium, separate from their corresponding primary channels. They enter the thoracic cavity and go through the sanjiao. They resurface behind the ear, and then they join with the sanjiao channel of the hand Shaoyang. The divergent channel of the hand Yangming, so the large intestine, and the divergent channel of the hand Taiyin, the lung, separate from their primary channels, enter the long and large intestine, resurface at the supraclavicular fossa, and then join again to the large intestine of the hand Yang-Ming. The 12 sinew channels distribute the qi and blood of the primary channels to the muscles, joints, and sinews. This is a lot to do with the fascia network. These are either considered slack or tight. They're primarily distributed or associated with the yang channels and are distributed on the nape, back, and lateral side of the limbs. The softer of the two, the slack ones, are associated with the yin channels and distribute to the chest, abdomen, and medial side of the limbs. In the Suwen, Wei Lun, it says the ancestral sinew dominates the controlling of the bones and facilitates the movement of the joints. And the liver channel of foot Taiyin converges around the genital region and links with all of the sinew channels of all of the channels, which makes me think that genital massage is the key to flexibility, but my yoga instructor disagrees. But maybe there's something to be said about the hip girdle and the pelvic floor that is very important for whole body flexibility. The cutaneous regions. These are where the 12 primary channels are reflected on the surface of the body. Use this a lot with gua sha. The Suwen Pi Bu Lun says the cutaneous regions of all the channels follow the pathways of their corresponding channels. So, just like regular channels on the skin. Key part is that they turn weird colors that are associated diagnostically. The 12 primary channels. The lung channel, hand Taiyin. The Ling Shu Jing Mai describes the lung channel of the hand Taiyin, originating in the middle jiao, running down to connect with the large intestine. It then returns and ascends along the cardiac orifice of the stomach and crosses the diaphragm before merging into the lungs. It leaves the lung system by way of the trachea and runs down along the medial side of the upper arm, anterior to the heart channel of the hand Shaoyin and the pericardium channel of the hand Zhuiyin, and then passes along the cubital fossa and enters the chunkou on the wrist over the radial artery where the pulse can be felt, along the radial border of the medial side of the forearm. It continues along the thenar eminence and ends at the tip of the thumb. A branch separates from the main channel at the styloid process and travels directly to the radial side of the tip of the index finger. It connects with the lung, large intestine, stomach, and diaphragm. Diseases that stem from the lung channel of the hand Taiyin are distension and fullness of the chest, panting, cough, pain in the supraclavicular fossa, and in severe cases, the patient will clutch the chest with two hands intersecting. These are caused by adverse flow of qi of the arm. The diseases of the lung channel of hand Taiyin relate to the lung and manifest as cough, ascending qi reversal, panting, restlessness, fullness of the chest, pain in anterior coldness in the anterior border of the medial side of the arm, heat in the palms. If there's excess qi in the channel, there will be shoulder and back pain, contraction of pathogenic wind, cold, sweating, frequent urination, and yawning. When the right side qi is deficient, that is the metal descending action of qi, there will be pain and coldness of the shoulder and back, shortness of breath, and change in the color of the urine. The general indications of the lung channel are diseases of the chest and exterior syndromes of wind, as well as diseases along the channel pathway. The points of the chest are lung 1 and 2. These are good for the lungs and local problems, such as problems in the pectoral region. Lung 1, 中府. This is the front mu point of the lung. On the chest, 6 chun lateral to the midline, in the deltopectoral triangle, approximately 1 chun inferior and slightly lateral to lung 2, at the level with the first intercostal space. Lung 1, first intercostal space. Chest and lung problems, shoulder and back pain as well. And this has a lot to do with the influence of the pec minor. Needle obliquely lateral, 0.5 to 0.8 chun. Avoid injuring the lung by never needling deeply toward the medial aspect. Lung 2, 圆门. On the chest, 6 chun lateral to the midline in the deltopectoral triangle superior to the coracoid process of the scapula. Exactly the same indications. Needle obliquely, lateral, 0.5 to 0.8 chun. Avoid injuring the lung by not going perpendicular. Lung points of the shoulder and arm, lung 3 and 4. These are basically just good for their local points for the most part. Lung 3, 天府, on the medial border of the upper arm, on the radial border of the biceps brachii, 3 chun inferior to the anterior end of the axillary fold. Another way to find this point is to reach up and look to the left or right and where your nose touches the arm. It's not that accurate because people scrunch their shoulder. This is good for asthma, nosebleed, lung diseases, pain of the arm. zero point 0.3 to 0.5 寸. Lung 4, 狭白, on the medial side of the upper arm, on the radial border of the biceps brachii, 4 寸 inferior to the anterior end of the axillary fold. Chest and lung diseases, cough, especially cough. This means clasping or kind of clenched white, and the white refers to the color of metal and the lungs. So this is good for opening the lungs. 0.5 to 0.8 寸. Forearm points, lung 5 to lung 9. These are really the points you end up using. Diseases of the lung and lung channel. Lung 5, 吃子. This is the He point. On the cubital crease in the depression on the radial side of the tendons of the biceps brachii. Aside from the obvious chest and lung diseases, this is used for acute vomiting and diarrhea, as well as convulsions in infants and pain in the elbow. Needle perpendicularly, 0.5 to 0.8 sun, or prick to bleed. Lung 6, 孔最. This is the Shi cleft point. Shi cleft points on the yin channels are used for bleeding disorders. So it's a lung, you guessed it, coughing up blood. That's its main indication. Sore throat, hemorrhoids as well, forearm pain. But yeah, when combined with lung 1, it's used for coughing up blood, with lung 10 for sore throats. This is where the channel enters deep, so you can really take care of those deeper lung problems. Perpendicular needling, 0.5 to 0.8 sun. Lung 7, 裂吹, the lower connecting point and confluent point of the renmai. On the radial side of the forearm, proximal to the radial styloid process, 1.5 sun above the transverse crease of the wrist, between the brachioradial muscle and the tendon of the long adductor muscle of the thumb. Lung diseases, but most notably this one's used for head and nape disorders. Because it connects to the ren, it's also used for irregular menstruation and dysuria. Now, why is the ren channel on the lung? Why is the ren connecting through the lung? Well, the lung has a descending action. And while the ren points are numbered bottom to top, in reality, the ren has a lot to do with the descending function, and the lung helps that happen. So as the lung is descending, it is helping the ren channel to continue its microcosmic orbit. This is often used along with kidney 6 for throat disorders. Lung 8, 金渠. This is the Jing River point. On the radial side of the forearm, 1 sun above the transverse crease of the wrist, in the depression between the styloid process of the radius and the radial artery. Asthma, chest pain, sore throat, lung stuff. Taiyin, lung 9. This is the Shu stream point and Yuan source point, and the influential point of the vessels. Qi pushes blood. Blood is the house of Qi. This is the source of lung, and the lung is the post-heaven source of Qi. The post-heaven source of blood is the heart. Pre-heaven, we're looking at the kidneys, of course. But for post-heaven, we're looking at the upper jiao. This is good for pulseless syndrome, wrist pain, cough basically gives the entire lung channel a boost. 0.3 to zero point 0.5 cun. Avoid the artery. Now for the points of the hand. Lung 10 and 11. Lung 10. Yu Qi. Fish border. Ying spring point. In the depression proximal to the first metacarpal phalangeal joint, on the radial side of the midpoint of the first metacarpal bone, and on the thinner eminence at the junction of the red and white skin. Because if you wiggle your thumb, it looks like a little fishy, and that's the border on the skin. Yeah, that's why it's called that. It's good for coughing up blood, loss of voice especially. Heat in the palms is a good point for draining off heat. Lung 11. Shaoshang. This is a Jingwell point. On the radial side of the thumb, 0.1 cun posterior to the quarter of the fingernail. Sore throat, cough, also heat stroke with vomiting. Mental disorders, it's very good for clearing heat and clearing the channel. Perpendicularly, 0.1 cun, or transversely, 0.2 to 0.3 cun, toward the wrist or prick to bleed. Moxa is applicable. The large intestine of the hand Yangming. The Ling Shu Jingmai states, the large intestine of the hand Yangming originates at the tip of the index finger, running upward along the radial side of the index finger and passing through the interspace of the first and second metacarpal bones. It dips into the depression between the tendons of the medial extensor pollicis longus and brevis, the anatomical snuff box. Following the anterior border of the forearm, it reaches the lateral side of the elbow and descends along the lateral anterior aspect of the upper arm to the highest point of the shoulder. Then it travels along the anterior border of the acromion, traverses the 7th cervical vertebra at due 14, and descends to the supraclavicular fossa to connect with the lung. It passes through the diaphragm and enters the large intestine, its pertaining organ. A branch from the supraclavicular fossa ascends to the neck, passes through the neck to the cheek, and enters the gums and lower teeth. Lower teeth. This is why large intestine channel is used for the lower teeth. And then curves around the upper lip and crosses the philtrum to end at the opposite side of the nose. From there, the left channel goes to the right, and the right channel goes to the left, to the side of the nose. The channels it connects with are the large intestine, of course, the lung, and the diaphragm. The organs it passes are the mouth, teeth, and nose. So this is why the large intestine channel is really great for mouth, teeth, and nose. And of course, making people poop. When to use this? According to the miraculous pivot, the Ling Shu Jingmai, sickness that stems from the large intestine channel of the hand Yangming are toothache and swelling of the neck. The diseases of the large intestine channel of the hand Yangming relate to body fluids and manifest as yellowness in the eyes, dryness in the mouth, runny nose, nosebleed, sore throat, pain in the front of the shoulder and upper arm, and pain and loss of use of that index finger, where the channel begins. When the large intestine channel is in excess, when the qi is in excess, there will be heat and swelling along the channel pathway. When deficient, the patient will feel cold, as though they're shivering, and find it difficult to get warm. You'll see that with especially older people. They'll feel very cold and have trouble getting warm, and people will say, well, that must be kidney deficiency. However, the Yang Ming has the most qi in blood, 斗气斗血. And so it's important to make sure that that post-heaven aspect is full so that people can have enough qi to feel warm without having to go to the bank account of the kidneys, cash in those inheritance bonds. We don't always want to be going to the kidney, especially if post-heaven will do the trick. Large intestine, indicated for diseases of the head, face, and 5 sense organs, diseases of the throat, febrile diseases, and diseases along the channel pathway. So starting with the hand, large intestine points 1 through 5 are located on the hand. Xiangyang, the Jingwell point, on the radial side of the distal segment of the index finger, 0.1 cun posterior to the corner of the nail. This is good for head and face disease, sore throat, swelling under the chin, dry mouth, toothache, deafness, and tinnitus, wind, mental disorders, and diseases along the channel pathway. This is a Jingwell point. It's going to clear out the entire channel. It's also the point that hurts the most. So you're just look at where the channel goes, what the channel's used for. Jingwell point is going to affect all of it by clearing heat pretty strongly from it. This point is used with pericardium 11 for heat stroke. Again, using points like lung 11 and pericardium 11. These are just going to be much stronger because they're Jingwell. Needle upward and obliquely 0.2 to 0.3 cun, or prick to bleed. Large intestine 2, 二间, the yin spring point, in the depression at the radial side distal to the second metacarpal phalangeal joint when a loose fist is made. This is good for all things that this channel treats. The indication that may be slightly different with this is nasal discharge. Profuse nasal discharge and swelling under the chin. But again, the entire channel has that effect, so not really that special. 0.2 to 0.3 cun. Large intestine 3, 三间. This is the shoestring point, in the depression on the radial side of the index finger, proximal to the second metacarpal phalangeal joint when a loose fist is made. All the same kind of indications, except that it also treats acute canthus pain and curled tongue with inability to speak. Large intestine 4, 合谷, the yuan source point, on the dorsum of the hand between the first and second metacarpal bones at the midpoint of the radial side of the second metacarpal bone. Indications for this are aplenty because it generally descends qi, so it's going to have great use in gynecological disorders, disease of the channel, of course, skin diseases. Anytime qi isn't sinking, this one is your friend. Perpendicular insertion 0.5 to 8 cun. Large intestine 5, Yangxi, the Jing River point, at the radial side of the wrist crease in the depression between the tendon of the extensor pollicis longus and brevis when the thumb is tilted upward, forming the anatomical snuff box. This is good for heat and fire diseases, more inflammation, redness of the eyes, etc. As the Jing River fire point, that's what you can expect. You reduce that, you get rid of fire in the channel. Reduce it at least. Points on the forearm, large intestine 6 to 11. Large intestine 6, 偏里, the lower connecting point. On the radial side of the dorsal surface of the forearm, 3 cun above the wrist crease, with the elbow slightly flexed on a line connecting large intestine 5 to 11. Borborygmus, stomach and intestinal diseases, edema, dysuria. This really has more to do with the large intestine's influence on water. Large intestine 7, Wenliu. This is the Shi cleft point. With the elbow flexed on the radial side of the dorsal surface of the forearm on a line connecting large intestine 5 and 11, 5 cun up from the crease of the wrist. Good for local wrist pain, malaria, chills, and fever. Also good for tooth pain. Large intestine 8, Shalian. On the radial side of the dorsal surface of the forearm on a line connecting large intestine 5 and 11, 4 cun above the cubital crease. Good for abdominal pain, borborygmus, elbow and arm pain, motor impairment of the limbs. Basically, it's a muscle point because it's otherwise kind of a loser point. 0.5 to 0.8 cun. Large intestine 9, Shanglian. So we just had Shalian, the lower one. Now we're having Shanglian, upper one. This is 3 cun below the cubital crease. Borborygmus. And yeah, just kind of local point for local muscle stuff. 0.5 to 0.8 cun. Large intestine 10. Now we've got a real winner. Shou Sanli. This is very important for tonification. It's the analog to stomach 36 on the arm, Yang Ming. On the radial side of the dorsal surface of the forearm on a line connecting large intestine 5 and 11, 2 cun below the cubital crease. Motor impairment or weakness of the arms. This is used a lot classically to tonify. Oftentimes more than stomach 36. Interestingly enough. Needle perpendicularly 0.5 to 0.8 cun. Large intestine 11, Chuchi, the He point. Flex the elbow at the lateral end of the cubital crease at a midpoint of the line connecting large intestine 5 and the lateral epicondyle of the humerus. This is good especially for skin diseases. You'll see people have eczema in this region, and that's a point at which heat and dampness are escaping that large intestine meridian. But you can kind of head off eczema in a general sense by reducing at this point. Used a lot for constipation, diarrhea, dysentery, and skin problems. And then, of course, lung, cough, asthma, febrile diseases. Points of the upper arm. Large intestine 12 to 14. Large intestine 12. Zhou Liao. When the elbow is flexed at the lateral side of the upper arm, 1 cun above large intestine 11, on the border of the humerus. Elbow and arm pain. In fact, the zhou in it means elbow, so it's for elbow stuff. 0.5 to 0.8 cun. Large intestine 13, Shou Wu Li. On the lateral side of the upper arm, on the line connecting large intestine 11 and 15, 3 cun above large intestine 11. Inability to straighten the arm, pain of the elbow and arm, and scrofula. Needle perpendicularly, 0.5 to 0.8 cun. Large intestine 14, Bi Nao. On the lateral side of the arm, at the insertion of the deltoid muscle on a line connecting large intestine 11 and LI 15, 7 cun above LI 11. Inability to extend the arm, hypertonicity, shoulder and arm pain, pain of the neck, scrofula, 0.5 to 1 cun, or obliquely 0.8 to 1.2. Shoulder points, 15 and 16. LI 15, 肩盂, on the shoulder, superior to the deltoid muscle in the depression anterior and inferior to the acromion when the arm is abducted. Good for shoulder problems and scrofula and goiter. Wind heat. Really, it's just shoulder stuff. Perpendicularly, 0.5 to 0.8 cun. LI 16, 巨骨, above the shoulder in the depression between the lateral extremity of the acromion and the clavicle. And scapular spine. Shoulder and arm pain. Inability to raise the arm. Shoulder and back pain. 0.4 to 0.6 cun. Points of the neck. LI 17 and 18.